Hello everyone and welcome to today's webinar where we will be discussing the initial diagnosis and treatment in PALS. If you have reached the initial diagnosis and treatment phase of care, the child or infant is not in immediate danger of death. While this means that you likely have a brief period to find the cause of the problem and intervene with appropriate treatment, it does not mean that a life-threatening event is impossible. Always be vigilant for any indication to initiate high-quality CPR and look for life-threatening events such as respiratory distress, a change in consciousness, or cyanosis. The HA recommends following the ABCDE method when making the initial assessment. The A stands for airway, the B stands for breathing, the C stands for circulation, the D stands for disability, and E stands for exposure. Assess the airway and make a determination between one of the three possibilities. Once an airway has been established and maintained, move on to breathing. So for the airway, you need to answer, is the airway open? This means open and unobstructed. If yes, proceed to B for breathing. Can the airway be kept open manually? Use the jaw lift or chin thrust, or use a nasopharyngeal or oropharyngeal airway. Is an advanced airway required? Endotracheal intubation or cricotomy if necessary. If the child or infant is not breathing effectively, it is a life-threatening event and should be treated as a respiratory arrest. However, abnormal yet marginally effective breathing can be assessed and managed. For breathing, ask yourself, is breathing too fast or too slow? Tapnea has an extensive differential diagnosis. Bradypnea can be a sign of impending respiratory arrest. Is there increased respiratory effort? Signs of increased respiratory effort include nasal flaring, rapid breathing, chest retractions, abdominal breathing stridor, grunting, wheezing, and crackles. Is an advanced airway required? If so, endotracheal intubation or cricotomy if necessary. Assessment of circulation in pediatrics involves more than checking the pulse and blood pressure. The color and temperature of the skin and mucous membranes can help to assess effective circulation. Paler blue skin indicates poor tissue perfusion. Capillary refill time is also a useful assessment in pediatrics. Adequately perfused skin will rapidly refill with blood after it is squeezed by bending the tip of the finger at the nail bed. Inadequately perfused tissues will take longer than 2 seconds to respond. Abnormally cool skin can also suggest poor circulation. The normal heart rate and blood pressure in pediatrics are quite different than in adults and can change with age. Likewise, heart rates are slower when children and infants are asleep. Most centers will have acceptable ranges that they use for normal and abnormal heart rates for a given age. While you should follow your local guidelines, approximate ranges are listed in the chart shown on this slide. In PALS, disability refers to performing a rapid neurological assessment. A great deal of information can be gained from determining the level of consciousness on a 4-level scale. Pupillary response to light is also a fast and useful way to assess neurological function. Neurological assessments include the AVPU, Alert Voice Pain Unresponsive Response Scale, and the Glasgow Coma Scale, the GCS. A specially modified GCS is used for children and infants and takes developmental differences into account. The AVPU response scale asks the following questions. Are they awake? They may be sleepy but still interactive. Do they respond to voice? Can be only aroused by talking or yelling. Do they respond to pain? Can only be aroused by inducing pain. Are they unresponsive? They cannot get the patient to respond. After you have progressed through the ABCDE method and have discovered a treatable cause and the child or infant has not deteriorated to a more severe clinical life-threatening situation, move on to performing a more thorough survey. This includes a focused history and physical examination involving the individual, family, and any witness as relevant. In terms of history, you could follow the acronym SPAM: signs and symptoms, past medical history, allergies, and medications. The focused examination will be guided by the answers to the focused history. For example, a report of difficult breathing will prompt a thorough airway and lung examination. It may also prompt a portable chest x-ray study in a hospital setting. Key point is that it's best to work from head to toe to complete a comprehensive survey. Make use of diagnostic tools when possible to augment the physical examination. Don't forget we offer online PALS certification on our site. We encourage you to become certified as soon as possible, whether that be on your own time with an online course or in an in-classroom setting. We encourage you to become certified as soon as possible. So thank you so much for tuning into today's webinar. We will catch you the next time.